Hello and welcome to Executive Decision. Every week we take a hard look at the state of the Indian economy. But today it appears that the economy, just like the economy around the world, has been bitten by the coronavirus bug. And how exactly the economic impact of it will play out will depend very much on how the outbreak itself plays out and how it is managed. And joining us to talk about that, who better than Dr. Prathap Reddy. He is the founder of the Apollo Group of Hospitals, joining us from Chennai. Thank you very much indeed, Dr. Reddy, for talking to us. Now, first, I'd just like to ask you a sort of set the ball rolling question on how seriously do you see what exactly is happening with the coronavirus, particularly in India?
I think the fact that WHO on Wednesday declared COVID-19 as a pandemic,
yes.
The government of India was forced after several consultations to impose all of these restrictions. So that has actually triggered a lot of anxiety and probably a little panic. I think what you and I should assure people are that so far only 58 Indians are affected and 17 of the Australian tourists that are back. So that is because if you now take proper precautions, it will not happen to us like what happened in South Korea or in Italy.
Right. So as far as the numbers are concerned, of course, the numbers keep changing. So what you said, I think it was about 55, 53, but now I believe the number has gone up to 75 and one person has actually been declared dead. We've had the first casualty of coronavirus in Karnataka, as you probably know. But overall, you're saying that it is nothing to get too worried about, that it is still something in India, it seems to be largely within control?
I think with the steps that have been already enforced by the government, I must congratulate the Prime Minister and the Health Ministry and the various ministries which got involved to take all of these steps across the country. Number one, to see that people are aware that such a pandemic is on, and the symptoms that typically comes is people who cough into you. You must be very careful when somebody is coughing before you. You should immediately cover your nose, either with your hanky or some tissue or whatever that is, because that is the way it is transmitted. It is transmitted by cough and it gets right into the respiratory system, or when you touch it and then take it near you. So these two things, if you avoid, this is the precaution that they are asking.
So these are good practical steps.
Because when you go out,
these are good practical steps that you're suggesting.
I think is a very important thing.
But let me ask you this: that in terms of how you see virus like this in terms of its ability to expand in a country like India, whereas we know that we have a very high population density, do you or does Apollo have any kind of projections on how you think something like this could pan out?
I believe this would have spread very in a major way. To a large extent, I compliment the steps that have already been taken by the government. So this will certainly contain this, because number of people who are infected, if are not many, the people who get the disease will be will be minimized. So this is where I think if you contain the disease to a few hundreds, then people who will get infected from them will be very much less. And if they take certain precautions, you can avoid get infected. And the different precautions are very easy. It is not like taking previously we say immunization. Immunization vaccine is not available for this. And the obvious thing is, if you see somebody coughing, you should avoid that droplets doesn't come near you. This is why we say 2 handful distances, maybe 6 feet is very safe. And before you touch anything, you must see that you do frequent hand washing. Frequent hand washing in any case is, I think, a very wonderful thing, because I see that in my village, I come from a small village for 60,000 people.
Yes.
The Dettol team, which is also doing this with the program, have done a tremendous job for the children, for the middle-aged people, and especially the older-aged people.
No, I think hand washing is very important.
They work so hard.
Yes. Hand washing is very important, but I just want to ask you.
One of the things which people.
Yes, just one thing though I want to ask you is that, of course, you're mentioning hand washing, those are very important measures. But I want to ask you that in terms of the actual number, because, there is some question over whether this is an accurate representation of the true number. Now, Ashish Jha, who's the director of Harvard Global Health Institute, told Time that the figure of about 74, 75 in India is not right because there's not widespread testing. At the moment, the government has earmarked only 52 facilities across the country which are testing. So, is that a concern that there's not enough testing, so the actual number may be more?
I think from what we see in our hospitals, in all of these days, there was only one patient whom we suspected, and then we immediately called the government. The government came and took the sample and told us in 4 or 6 hours that it is negative. So I don't think it is already widespread. It could have widespread if we had not taken any precautions.
But what about?
But I think it is now.
What about
from the
steps
lessons
taken
that we learned from Korea and Italy?
Right. So what about steps taken now by private players like yourself? Because at the moment it seems that the government hospitals and the government medical system is doing all the heavy lifting. What steps, if any, have you taken, sir?
I think first we have completely seen that all the Apollo hospitals and the Apollo infrastructure, whether it is a pharmacy, whether it is a clinic or hospital, they are all given complete warning and what people, if they come, to give them the proper information.
Okay.
To majority of the corporate groups who have spread by way of video or by way of media, by way of communication, we have told them what to do, what not to do. The do's and the don'ts we have very clearly told them.
Right.
They are very, very thankful. The corporates are very thankful. And I think they are also taking it because they are telling their families and the message is going on to the others. We have now taken up to the schools and colleges too to pass on this information. Over 300 corporates are with one of our groups for wellness program. For all those 300 corporates we are going to cover, and also all our hospitals, our 24/7 emergency number.
Yes.
At any time, anybody could call.
Right.
With any doubt that they have on the symptoms they have or the exposure they had about certain person.
Okay.
We will advise them properly what precaution that he has taken is right and what he needs to do further.
Have you created?
I think this is a major thing that we are doing across the country.
Are you also creating any special facilities within your hospitals for potential, affected patients?
Yeah, you are aware that we took care of the previous SARS in all our hospitals. We had special, separate isolated beds. From anywhere from 10 to 25 beds in each of the hospitals.
Right.
And a group of team who worked very carefully. And I'm glad to say that when they came to us, our results were excellent.
Okay.
Another thing also, we tackled the other very, very serious problem called the MARS, which occurred in Saudi Arabia. I got a midnight call from the Minister of Health, Saudi, saying that it is not only killing the patients, killing the doctors and nurses in the CCUs. So we sent our team and they put in the process protocols, and fortunately that stopped not only because of our steps, I shouldn't tell that, because the country also warmed up. So we have good experience, we have sufficient experience to tackle. We have tackled the SARS, which is much more serious, and I am sure if the government wants us, there are other hospitals have all offered, and we have several of our other facilities ready, and the teams are ready, if necessary, to take this on. And I think their decision now not to open too many places is correct because.
So just one second, in addition to the facilities, you're saying, are you also creating any testing facilities?
No, I'm saying the testing is not, it's not available with us. The testing kits are far and few. It's all, that's why the government is having in the 54 centers. They are hoping to increase it to by another 50% in the next week or so.
Okay.
But we have not, at the moment, in all of these cities, we have to send it to their centers.
Oh, I see.
They come and collect it, and
okay,
within a very short time they give the report.
But you're saying the testing kits are very few. Is that a matter of concern? I mean, how many kits? Do you have any idea of how many kits we have and how many we need?
I think the reason why there are not that many kits is reasonable because first of all, this virus is new, so we don't have an antibody to develop the vaccine, an antibody to test this. So it has just happened. I think that is why the supply all over the world on this detection is very little, but they are continuously working. So I'm sure, if necessary, more and more kits will flow into the country. Their government is actively working on that to get more kits.
Okay. Well, let's hope they do that. Is the testing expensive to your knowledge?
I don't know. In this patient, first patient that we had, they never charged the patient. Charged us or charged the patient. So it was done by them. And I don't think they are charging because I think it's at this moment what they are trying to see is to identify the victim so that he does not spread the disease to others. So this is where I think they have restricted, saying that only government hospitals and recognized centers will be there for treatment also.
Okay. Now,
so
are there any Are there any lessons that we can learn from other countries in terms of both do's and don'ts? Because if you look at the examples of countries that have done well and they've perhaps not done well, so amongst countries that are apparently not tackling this adequately are America and Europe. A WHO, World Health Organization doctor, has been quoted as saying that he fears that America and Europe could be Wuhan plus, referring to Wuhan, which was the epicenter of the epidemic.
Yeah. I think this is true because I think, to a large extent, Italians are like us. They mix with people, they are very friendly, they are very courteous. So you see what happened to them. Because of that friendliness, the disease spread very rapidly. Actually, now they have come into the shivers.
Right.
I think Europe should take that lesson. The rest of the Europe should take that lesson, and even US, because it is not trying to feel sorry. It is not you or who are sorry. The person who takes the decision is not sorry.
Right.
Because it is the patient and the transmission he is doing for his friends, colleagues, or family.
Right.
So I think we need to take instead of being panicked, we should be very, very, very cautious.
I think that's a good point you make.
This is why we say the don'ts and the do's are very important in
you're right, that Indians are we're very social beings like the Italians, but the entire message of this particular outbreak is that we have to do social distancing. So I think that's something which I think now people are sort of trying to get around. But there is obviously the immediate impact of this on the economy. We've already seen what happened to the stock markets this morning. Luckily, they recovered later on.
Yes.
But going forward, given that the economy is already somewhat fragile,
Apollo has also felt this.
You felt this as well?
Yeah.
The Apollo stocks as well?
Yes. Significantly.
Oh, significantly.
Yeah.
Right. But overall, do you see this having somewhat of a negative impact on the economy?
I think it because there's a lot of loss of jobs, loss of work, loss of production. There is a universally there is going to be some effect, but India will pick up very fast because people who are on the go will come back into that spirit the moment we control this in the next week or so. I believe, as we see it, in the next 7 days, they have put it as 31st of this month. By next 7 days, we should probably see that the spread is not rapid, and then if it is not rapid, then you can see that decline. But I think people now have become very conscious, thanks to the media, thanks to all of you, who have given this scare for people.
Yeah.
I want that scare to be changed to precaution.
Okay, that's an important thing you're saying.
Take the proper
Dr. Reddy,
precaution.
You're saying that within the next 7 days, we'll hopefully see a decline in the number of cases.
I believe so, Srinivas, because the way various steps that have been taken will certainly cut down the spread of the disease.
Okay.
And whatever would have happened if we did not take these steps might have been, something like Korea or Italy.
Right.
Because we are also the same type of people who have got probably more underlying disease than the Italians. And certainly in this case, especially people whose immunity is already low, because if they are diabetics, if they are taking some steroids or immunotherapy for something, all of these people must be much more cautious. In
I think that's a very hopeful.
The precautions are really too.
Let's really hope for. No, I really hope, fingers crossed, that your prophecy comes true, that the numbers come down. Absolutely. The last question to you, that you said that you will be making arrangements at Apollo hospitals around the country to try and make room for people who might be affected. But will you also be making it affordable for the Aam Aadmi and the Aam Aurat, were it to come to that?
Thank you, Srinivas. Let me assure you, we always look after the people when they are sick and desperate. In all our 73 hospitals, we have provided certain number of beds with complete isolation. The teams are ready if need to be done, because as I said, from our previous experience of dealing with SARS, we dealt only in a few hospitals. But today, every single hospital has got the complete management team and the processes that they need to take and the procedures that you do. I assure you that nobody will feel that we have overpriced them or pushed them hard if they can't afford it.
Okay.
First, our thing would be to save his life.
Right. Appreciate that, Dr. Reddy. That's that's wonderful that you're sharing that information.
I think it's something which
with us.
Our country should take all the possible steps so that we don't fall into the same level as others.
Okay. Thank you very much indeed,
Dr.
Reddy,
from them.
for doing your bit.
Thank you, Srinivas.
With
it's
this
very,
outbreak.
very nice
Thanks
to
very
be
much,
with NDTV. It's always a pleasure.
Thank you.
My compliments to you.
Thank you very much, Dr. Reddy. That was Dr. Reddy on Executive Decision. Thanks so much for watching.